Well, hello everyone. Thank you so much for joining us again here for session two of the Neuroplasticity Alliance's Rewire Your Brain education series. My name is Sherry Odom, and I am the executive director and founder of the Neuroplasticity Alliance. And thank you for joining virtually. We're also here in the Northeast Regional Library in Kentucky, Louisville, Kentucky, in the Purple Room, as you can see behind me. So we're excited to have a couple of people here in the room with us, joining us in person. And I want to tell you a little bit about NPA, who we are, and why I formed this organization. But what I want to do first is I want you to get a good understanding of why we created this series. I want you to gain the information and a good understanding of why we're doing this, which is to help individuals who have some neurological challenges understand and be able to leverage all of the discoveries in neuroplasticity that have taken place in the last really 5 years has been a big shift, and we have changed the paradigm from being compensatory, so creating workarounds for those individuals who have neurological challenges, to something of recovery, right? So that's a big deal. So you don't have to work with it anymore. You can try to recover and regain what you've lost, or gain new functionality if there's something you're trying to enhance from a cognitive standpoint or from a physical standpoint. So these things are very exciting. It's brand new in the world of neuroscience, and I want to make sure that everyone is able to leverage what's happening from a treatment standpoint. I want you to be able to research the therapies that are out there, evaluate them for whether it's a fit for your particular situation, and be able to develop a care plan with your healthcare provider so that you can discern whether it's something that you would like to try. So, to give you the information you need to go out and explore this on your own and make a decision if it's something that's worthwhile for you. I do want to encourage you to join us for all 5 sessions. Today's session is exploring treatment types, and we do have 3 others after this. Last week we dove into what neuroplasticity was and how you influence it. This week we're going to be looking at those treatment types, and then in the coming weeks we're going to be looking at how to apply those for your own special situation. In today's conversation, we're going to be walking through quite a few, like 3 different segments of treatment therapy types. So those that create and put your brain into a state of plasticity, those that really help you modify and remap it, and then those areas that can stimulate your brain and really do a little bit of both from an external standpoint. I do want to encourage you to work with your healthcare team before trying any of what we put out there today, because neuroplasticity can be both positive and negative. You want to make sure that you're working with someone who is trained in how to apply it and knows what they're doing, because you want to make sure that you walk away with the results that you're looking for and not something else. So please do work with your healthcare team. Well, I do want to tell you a little bit about NPA, and I want to review some of what we discussed last week on neuroplasticity. And then I'm going to inspire you with some case studies for some of the individuals who have used neuroplasticity to recover from their neurological challenges. Some of these individuals are really pioneers and who have used their experiences to create treatment methodologies that have really sort of laid the foundation for neuroplasticity based therapies. We'll go into, again, like I said, what some of those treatment therapies are. And then we're lucky enough to have Dr. Marla Golden join us, and she has a practical application for persistent pain that she's going to share with us. And I want you to pay attention today to what those categories are for the therapies, because what we'll do next week is take that information and look at how to apply that for individual situations. So while next week will be standalone, you don't have to listen to today's session to be able to participate in next week's. There is information that will help you really take a better advantage of the information that is going to be shared next week. Okay, so a little bit about NPA. I started the Neuroplasticity Alliance back in 2020 after several treatments that I found really transformed my life, both from as a caregiver and as a mom. And my mother had multiple sclerosis. My daughter had dyslexia, and we had been going through the regular treatment recommendations for those. Discovered neuroplasticity, and it really changed the game for us. My mother was able to walk again, and my daughter is now an A+ student. And it really made me and inspired me to want to share all of that information with people who may not know about it and be able to leverage that because it's not really mainstream yet. So, my goal with NPA is to accelerate the development and adaptation, adoption of this information so that more people can take advantage of it faster. Um, the way we're doing that is really twofold. One is through education, seminars like this to help people who can benefit from that information understand it, and like I said, be able to evaluate the technologies for their applications. And the other piece of this is really to support the ecosystem. It takes anywhere from 15 to 20 to 30 years in some cases for new discoveries to really reach mainstream care. And I want to help accelerate that process by one, making sure that we can get insurance to cover some of these processes, making sure that the research is done that can help bring this to the mass population as quickly as possible. And then to scale, help the innovators in this space scale their technologies so that you don't have to travel to Chicago or Toronto, in my case, to be able to benefit from these therapies. And in the end, what I really would love to see out of this is a world where neuroplasticity based therapies, that is a mouthful, right, are the standard of care and not something that individuals go to when they're at the end of their rope, which you'll hear has been the case in many of the individuals whose case studies we'll see tonight. So, who benefits from neuroplasticity? If you look at the statistics, is about 50% of the population that genuinely has some sort of neurological deficiency. And if you compare that to some of the other health challenges that are prevalent out there, you'll see that really it is two times those combined. So, COVID, diabetes, cancer, cardiovascular. If you add all of the individuals impacted by that, you would see that even two times that amount are affected by neurological disorders. So it's really a challenge of epic proportions. And while they do manifest in different ways, which is, some examples that are shown on the left of this slide, there's brain injury, there's dyslexia and autism, Parkinson's, and anxiety, depression. Those things are all the root cause of that has to do issues that originate in your brain and in your central nervous system, which can benefit from neuroplasticity. So this is something that can drastically help a wide range of people. So it's important that we get this information out here. So a little refresher on neuroplasticity, if you weren't with us last week. In very simple terms, it is the brain's ability to modify itself through experience. What is that experience? It's your anything you feel, so emotions, anything you think, your thoughts, physical activity, movement, any sort of sensory input that you get reshapes your brain. And this is a really big deal because the discovery of this reverses almost everything we knew about the brain for the last 400 years. And what we've discovered is that we didn't necessarily have it all wrong, but a lot of it was incomplete, and some of it was just ugly. Uh, 1960, Eric Kandel did a lot of the work to demonstrate that neuroplasticity was relevant, but it wasn't until the year 2000 that he won the Nobel Prize for it. And it really wasn't until 2015 that you see sort of a lot of discussion and some general acceptance for it in healthcare circles. And really, not until 2020 do you start seeing the application of that on a widely accepted level. And it's still not, you can go to your physician today and you likely will not get a reference for it because while the discovery has been accepted, how you apply that in the therapies that are out there have not completed the full research cycles that traditional medicine wants to see. But it doesn't mean they're not there. It doesn't mean they're not, don't have evidentiary proof that they work. It's just going to take a little bit more time to go through that cycle to be able to get it to the standpoint where it's accepted on a widespread level. And it's changing at an extraordinarily fast rate. Just as an example, in June was the an article, a research study was published that definitively put a nail in the coffin on as to whether we do generate new neurons. The answer is yes, we do generate new neurons. It is a small amount, it's not huge, but that has now, although it was somewhat widely accepted, there were still people who resisted that until this last research paper came out. And every day I read some sort of news about some sort of discovery. When I first started this organization in 2020, I looked at what research had been done in this space, and there were maybe 10 really good papers on it, several clinical trials, literally one hand, I think maybe around 5 clinical trials that had been done. And if you go to our website today, you'll see that there are over 100 clinical trials in process looking at how to apply neuroplasticity. So every day we're learning new information that really is changing the game. And some key things to take away from this. So I mentioned that we generate new neurons throughout our life. We also can shape neuroplasticity in our brains up until the age about 25, you sort of learn through osmosis. Your brain is really working, not you don't have to concentrate and focus to sort of learn. It's easier process. After the age of 25, you can reshape your brain, but it requires focus. It requires some sort of challenge. It's got to be a little bit of work, and it has to be repetitive. You've got to do it a number of times for that to take hold. And the last piece is the personalization component of this, which is very important because your brain is different than my brain. And at the end of this session we go through today, both of our brains will be different, but you will take the information that you gain and it will shape your brain differently than it will shape mine because of your starting point and your perceptions and your belief systems and your emotions to it and your thought process. So this was sort of my point about please work with your healthcare team to implement these because you have to understand where your starting point is to be able to figure out how to build a path to get to where you want to go. Excuse me. I do want to just show you real quick what neuroplasticity looks like in action, one form of it. This is a video that Dr. Landowski put together, and this is two neurons that are working together. And what drives that is, again, like if you're an adult, it's your focus, it's your attention, it's repetition. You're building the connection between these two neurons, which is what in one way changes your brain. So I'm going to share this video.
What we're looking at here are two neurons.
And if you see this video, those little, it looks like little small hairs, they're dendrites, they're connecting to one another. And that's what's driving, your action is what's driving that. So what you saw there in that video really was in some pieces the two dendrites, the pieces that were, it looked like little hairs trying to connect to one another. In between those, the brain is sending out chemicals from one end of those dendrites to the other end. Those are called your synapses. And they're proteins and other types of chemicals that your brain produces, acetylcholine, dopamine, those are norepinephrine, those are several that you're probably very familiar with and have heard, at least in some way, shape, or form. And your neurons release those chemical messages to tell the other one what to do. And they sense that and are drawn to it and they connect. And those neurotransmitters, those chemicals cross over from one area to the other area. And because this can happen very fast, this is really how your short-term memory gets formed. Now, if you're trying to take that short-term memory and change it into a long-term memory, that's when your brain really makes these structural changes. So those two neurons connect together. They then grow stronger. Other neurons come to that, and then you form these groups of neurons in your brain, and those are structural changes. And that's really the tissue of the brain reshaping itself. And that is where you form your long-term memories. And the last piece of this is sort of the way the brain functions. So the more you use those neurons, the stronger that gets, right? And the speed at which that works accelerates and becomes faster and faster and better and better. And that's how you increase your performance. You enhance your working memory, your processing speed, your physical performance. All of those things become more efficient because brain actually changes the way it works in response to that. If an area of your brain is more excitable, it changes dynamically the way the other areas of your brain work. So these are the three key ways in which your brain changes, and they typically all work together. Every now and then you get changes or support one another. Is a beautiful symphony, actually, in a lot of ways. So I want to now turn our attention to some of the case studies that I wanted to share with you today. As I mentioned, a lot of these individuals are pioneers and really early on creators of applying neuroplasticity to create treatments that can make a difference. One of these individuals is Barbara Arrowsmith Young. She is a remarkable human, and I've got a little bit of her story to play here for you in this video that I'll show in a minute. But she, in essence, was born with some very serious learning disabilities. She had difficulties with spatial reasoning, abstract concepts, interpreting language. She had very slow processing. Dyslexia was also as part of that. She felt like the left side of her brain, her body, sorry, was really disconnected and it felt alien to her. So she had this disconnection of self. It caused her that with her poor spatial reasoning really caused her to get lost all the time. And she was socially awkward and had, some emotional challenges with that. It led her to try and commit suicide when she was in the 8th grade. She recovered from that and came back, and really her father, who was an inventor at GE, helped her to put a different perspective on that and say, look, yes, these challenges are hard, but why don't you turn your attention to solving the problem? And from that point on, she really spent a lot of time learning how people learn and went into education. She finished her degree with in education and then went back to get her PhD. And that is where she discovered exactly what was wrong with her brain, which specific areas of her brain were not functioning in an optimal way. And then she also learned about neuroplasticity. So she was able to devise exercises to retrain her own brain and discovered a way of doing this that could help other people. As a result, she now has over 100, it's either 100, it's 100, she teaches programs, or she has a program that occurs in schools, and she also has individual schools, the Aerosmith program, where her program is taught. What I'll do is we'll make sure to have links to these in the notes for the presentation. I really would encourage you to listen to Barbara's TED Talk. She is she epitomizes what neuroplasticity from a transformational standpoint can do for an individual. So, please, if you watch any of the videos that we share today, I would say that would be the top one for my recommendation. It's truly inspirational. Okay, so the second individual I'd like to share with you is Dr. Clark Elliott. Dr. Clark Elliott is a AI professor at Purdue University. He in 1999 had a very minor car accident. He was at a stoplight. Somebody hit him from behind, did very little damage to his car, but it caused a concussion that was difficult enough that within 3 days he was having trouble remembering the name of his five children. He couldn't force his body to move. He would sit, and say, I need to get up, I need to get up, I need to get up, but he couldn't actually do it. He would go to the refrigerator. He would say, I'm hungry, but he couldn't bring himself to reach into the refrigerator to grab those food items and to feed himself. So he lost a lot of weight and became very frail, and continued to decline over a 10-year period. His um he almost to the point of the state, he was able to maintain his job at Purdue and continue teaching because he had the same class he had been teaching for many years. And one of the things that he did, he was able to do is take notes, extensive notes on his situation. So while he couldn't open the refrigerator and decide what to eat, he was able to capture what was happening in his brain, and he wrote extensive notes that allowed him, after his recovery, to write a book called The Ghost in My Brain. And this book really details his recovery. It is a must read for anybody who not only is experiencing a traumatic brain injury, but is caregiving for somebody who has a traumatic brain injury. Because people, when you have a brain injury, you don't exhibit a lot of the symptoms that people understand. They think there's nothing really wrong, or they don't understand your behavior. And this really blew that insight wide open and put a microscope on it so that people can understand. I'm not going to play the video here. I'll let you, since we're having trouble hearing that. But I will go and listen to the video because it's the part that's in here. He does talk uh, and the therapy that he used. He and I'll just summarize it for you here in simple terms. He was heard about neuroplasticity from Norman Doidge's book, went in, Googled it, and was luckily lived near of some of the two of the leading neuroplasticians, Donna Lee Marcus, which is Designs for Strong Minds, and the Mind Eye Institute, also in Chicago, which is Dr. Zelinsky. And the two of them, within 3 weeks, he started having changes immediately. Designs for Strong Minds and Dr. Donna Lee, she is a cognitive expert. She's done work for NASA to improve the performance of their engineers. She's done a lot of corporate work and does a lot of work for individuals with brain injury, depression, anxiety, and has both in-person as well as electronic applications that you can leverage if you're unable to travel to her in Chicago. She immediately referred him to Dr. Zelinsky at the Mind Eye Institute, who really specializes in integrating sensories. So what happens in a lot of individuals who have autism, AD, brain injury, you lose the ability to integrate your senses, and your vision and your ears are they work together to help you understand where you are in space for that proprioception, to help you be for your balance. And Clark was had towards the end of his 10-year struggle with this, was literally almost unable to walk. He couldn't, he had to crawl at times when he would take an elevator because it would um, mess up his balance so much. And then the other interesting thing about him is he had to learn to sleep with his eyes open, because when he closed his eyes, he would become violently nauseous because of the lack of his vision to be able to solidify his position in space. So Dr. Zelinsky has developed a therapy to integrate both your vision and your hearing. And within 6 months of doing these therapies, Clark was able to recapture his cognition almost to the point where he was back to his normal. He continued to work with them, and over a 2-year period, he is now at the point where he said he has enhanced cognition before his injury ever occurred. So it's a phenomenal story. I really encourage you to go and listen to his video. He has spoken to he has spoken and has, in addition to this, there, which is a short little snippet, there are several longer interviews done for him that are really worth reading, that have reached millions of people. And in the brain injury world, uh-oh, pardon me just a second. Looks like we're something happened here with the Zoom and they're not seeing my screen. So Izzy is trying to fix us. Bear with us for just a second.
Zoom. I don't know where it's hovering. Something in Zoom.
Oh, apologies, guys. We're trying to figure it out on our end. It just stopped automatically here. There we go. That's got it. Okay. Um, all right. Okie dokie. So back to Frank there. uh, so Frank is an individual who started noticing that he had some cognitive issues and memory lapses in his early 50s. He decided to ignore that. And in his 60s, finally went to go see a doctor about it. He was diagnosed with Alzheimer's at that point, and it was progressively getting worse. And at that point, he felt like he needed to take action and move to Mexico because he knew he was 24/7 care. And in the process of between age 50 and age 62, he continued to work, and Frank had been a very successful businessman and had an entrepreneurial spirit, and had run a couple of businesses. And unfortunately, his his lack of cognitive abilities started to catch up with him, and he was no longer able to run his businesses, but refused to accept that, and ended up going bankrupt, and had to and that's part of the reason why he moved to Mexico, so that he could afford the care that he knew he was going to need. Along the way, he just happened to be in a restaurant and heard some ladies sitting next to him discussing the Dale Bredesen protocol for Alzheimer's and the results having. And he got the book. So Dale Bredesen has written several books about his protocol, and he said, "Okay, I'm going to try this," but he couldn't get into Dr. Bredesen because it was a long process. I think he waited about 6 months before he could get in. And during that time period, he started to try and implement some of the protocol's components that he felt were relevant to him in his book. He did start to see some improvement, but it was another, like I said, another 6 to 7 months before he was able to get in to see Dr. Bredesen. And at that point, he started the protocol. And within 3 weeks, he started to see significant enhancement. And within about 6 months, uh, Mr. McNear was almost back to his to the level he was at. He says within his late 50s. So he had been able to recover all of his cognition and physical stamina from that standpoint. And he is now 73. He has written two books, one on called Defeating Dementia, which really just details his story and his process, encouraging people to get tested early, and to stick with the program, because he did have a relapse at some point, and it's a very rigorous protocol, but it is shown to reverse Alzheimer's. But almost everyone does have a relapse at some point because it's a very strict diet. It's a very strict routine of controlling your environmental factors, and it's a very, very hard thing to do. You have to have your family on board to be able to do that successfully as well. And during that entire process, he was working, his wife was taking care of him, and he realized he would not have been able to get through that without wife there, which is why he has written this second book now, Taking Care of the Caregivers, because it is such a critical component of implementing not only this protocol, but anyone who's going through any neurological challenge, right? That support system is critical. And I should mention that even though he did have that relapse, and it took him, I think he was, if I recall correctly, for about 3 weeks, he stayed off the protocol. He did notice that he was having some challenges. He was being featured in a documentary and almost withdrew from the documentary because he had gone into relapse. But they encouraged him to stick with it. And within 3 weeks, he was able to recover what he had lost during his relapse. So it's a remarkable story. I did not include a video here, but there are quite a few online that you can Google from him, and also several of the other Bredesen protocol people that have been featured in his most recent book, which is, oh my goodness, the title of that is For Survivors of Alzheimer's. Dr. Bredesen has 6 clinical trials underway right now that is showing without a doubt the reversal of Alzheimer's if you stick with his protocol. And it's extremely phenomenal. I, as NPA, really want to be very agnostic with providers. I don't take any donations or partnerships in a general sense with any of the providers, because I want to maintain a level of independence and be not biased. But it's hard to deny what Dr. Bradesen's work is doing. So I encourage you to go out and discover that if you know discover his work if you have anyone in Alzheimer's in your family or your network. Um, so this is the last case study I want to share with you in this portion of the presentation. This is my daughter. Her name is Sophia, and she is one of the main reasons that we started NPA. She was diagnosed dyslexia, dyscalculia, ADHD, and quite and a few other learning differences. And she one of the things that we noticed was important as we learned, she had constant ear infections as a child, as a toddler, and even today she still has ear infections when she gets sick. And one of the things that we learned when I read Dr. Deutsch's book is that when you are learning to hear and process that sound, the way in which your brain interprets that sound is very critical, and it can map it incorrectly. That's exactly what happened with her. Because she in her ears clogged, the way she processed that sound was inaccurate. So she had a very difficult time of interpreting sounds. She didn't have any trouble hearing. Her hearing is fine, but it was the way in which her body processed that sound. So we found a therapy that was in Toronto that was mentioned in Dr. Deutsch's book. We had to go to Toronto 2 times. We were there for 2 weeks and then home for about 8 weeks and then another 2 weeks back in Toronto. And we did see improvements between those two sessions. About 2 weeks after we got home is when things just changed. It literally, she woke one morning and then she came from school, and that afternoon she was like, "Oh my gosh, Mom, I all of a sudden can really understand what I've read. I can read it, but I also comprehend it. And I can do math." And my husband will testify to what a difficult process that was of learning her multiplication tables over and over and over again. So it really changed the game. She was a C level student before, and she's now got a 4.7, and at the top of her game. I am thankful for the Listening Center, which is in Toronto, that really changed her life. And as a mom, it changed my life as well. And you've seen quite a few of these other people who have been transformed by neuroplasticity based therapies. They want to tell their story, they want to share it, they're inspired to do something about it. And she's no different. She has been working on a book that she hopes to publish soon in her junior year of high school, that sort of talks a little bit about her journey and to try and encourage children who are getting diagnosed with dyslexia and some of these other learning differences to stay the course and to realize that they have special powers that they can leverage themselves. Okay. All right. So I want to now move into the section where we're talking about the types of interventions. And I know you've heard me through these case studies reference a couple of providers, but that's not what we're doing in this section. We will talk about that in later sessions. But really, what I want to do in this section is give you an idea of what the categories are, so that when we move to the next section, you'll be able to think about it in certain ways of from a holistic standpoint. So if you think about these six categories in general terms, they're either changing the state of plasticity in your brain, so how quickly your brain works, how plastic is it, how easily is it that you can reshape it. So that's one. It's the activities that you do to remap it, to retrain it. So that's a second set. And then there's this third set that is really stimulating different ways, and that would include really sort of it's a combination of all of these, but more specifically in the neuromodulatory area, those are sort of the third set. But I will say there are in the cognitive goals, those all um, would come into play there on the dating component. Okay, so we're going to first move into the lifestyle. And well, before I do that, let me just walk real quickly through these. So lifestyle, these are things that you can do and change in the way you live your life. Cognitive and behavioral, these are the things, the activities that you do to remap how. Neuromodulatory, so these are typically external devices or activities that you would do to stimulate your brain and change the way it's functioning. Pharmaceuticals, very similar as well, changes the way it's functioning. Um, it does neither of those really change your brain unless you're doing some of the remapping work itself. Then there's the environmental and social component. So what is in your the ecosystem that's affecting how your brain works and how you're processing information, and then detoxification. And these are things that prohibit plasticity and really are negative factors that are equally as important as influencing changes. So removing things that are negative, as well as improving things that will be positive. Okay, so of the things in lifestyle arena that you can change that are super effective, it really boils down to two: exercise and sleep. Last week, we talked a little bit about the cycle of neuroplasticity. One is how plastic is your brain. The second step is sort of making those changes. And then the third step is sleep, because the sleep really cements what you've learned, the remapping that you've done, and anchors it and strengthens it. And then that sort of process is ongoing. It's cyclical, right? So if you don't sleep well, then you don't have an opportunity to cement what you've learned, and that affects, as we learned earlier, your long-term memory. So you need it 7 to 9 hours of sleep. It needs to be, and these are not things I'm sure you've not heard if you read anything in the healthcare space. They're always talking about how much sleep you get, how deep is your sleep, and is it interrupted or not. And those are the key things that you really need to focus on that affect your neurotransmitters. So remember the synapses, the information that's crossing those, that really affects that. And it's very critical to maintain that efficient signaling. Exercise. So I saved this one. I did this slide in reverse order because I do believe of all these, this is probably the most important thing. It's because it puts your brain into this plastic state naturally. So before you ever do any remapping type exercises, you want to get some exercise, and it will be effective. That exercise will enhance your BDNF, your brain-derived neurotrophic factor, that really puts your brain in an accelerated state of plasticity. It's sort of like Miracle-Gro for the brain. And if you exercise within 30 minutes, I'm sorry, 3 hours before you do any of that remapping work, it accelerates that learning process. And that's from a changing standpoint, that's important, but it also causes a lot of physical changes in your brain. Um, and particularly the hippocampus portion of your brain, which is where your long-term memory and your cognitive thinking and your ability to do executive functioning type processes occur. So, your nutrition from a lifestyle standpoint is equally important. And if you will learn about the Bredesen protocol and any type of other multimodal, meaning looking at the various things that affect you overall, right? Multiple modes of change. You will see that the nutrition is a very important part. And why? Because if your brain doesn't have the chemicals that it needs to work, it's not able to create and strengthen those synapses. It cannot seal the memories that are out there. And these factors that I've got on this slide are some of the key things that I think you really need to look at. There's so much out there. There's a lot of noise on nutrition, and it's all important. But if you're looking at plasticity, these really are the key things that you want to do and pay attention to, and make sure that you are getting enough of these. And the best way to do that is through blood work. You've got to go get your blood work to be able to see where you are on these things, and then evaluate what sort of supplements you want to take. Um, fatty acids like omega-3s, again, that comes back to your brain's flexibility, the ability for it to change quickly and produce BDNF, things like fish oil or flax seeds. Um, the vitamins B complex, again, neurotransmitter synthesis. If you've got low vitamin D, you need to make sure you correct that right away. That's one of the big cognitive factors that you read about. It's actually, they're putting vitamin D in the category of hormones now because it's such a critical role. Antioxidants and polyphenols, these reduce oxidative stress in your brain. It's critical to reduce inflammation and then upregulate that BDNF. And we're going to talk about ways to enhance that. And then supplements. So lion's mane, ginkgo, and rhodiola really are some of the key factors that you want to take a look at. These are all suggestions. As I said, you really need to understand where you are through your blood work. Make sure that you understand where your deficits are from just a check on yourself, right? So how is your brain functioning? Where are the deficits? And then you look at, and then you can come back and evaluate these and see what makes sense for you. Okay, so we're going to move to environmental and social factors. Sure, yeah, we have a question.
So if I
Is he's gonna read it?
So one question is, I find exercise really fatigues me. I teach it, but I always do wonder if anyone else feels this way.
Well, I'll let anybody who is on the group here chime in if they have some thoughts on that. So from my perspective and what I've learned about the brain is it's and I don't want to speak out of turn because I don't know your situation specifically. I don't know what challenges you're going through. And I can certainly appreciate the fact that exercise can be, and you have to start from where you are, right? So you always, I don't know, is walking to door that overexertion? Is a 2 mile run overexertion? And those are, some of the extreme circumstances. But you need to, your brain, the more you do it, the more your brain likes it in a general sense, right? So you're rewiring that, and your body produces these chemicals like the BDNF that enhances BDNF, dopamine, serotonin, and your body then begins to crave. So it is a process. It takes 21 days in the brain to change that process. And, setting some discipline in place to help you get to that point is the right thing to do from a brain remapping standpoint. But again, you have to start from where you are. Okay, I hope that answers that question. Okay, so when I think about environmental and social factors that affect you and what you can do to enhance your neuroplasticity, there's three key things: social engagement and interaction. So you will find people who are having cognitive deficits really become more isolated. They don't want to interact. And certainly this was one of the things Frank McNear talked about in his story, is that he didn't want to go out and engage because he was embarrassed on who he might not know. He might not be able to follow the conversation. And this happens in older age as well. If you can't hear well or see well, you tend more isolated. That down your brain and creates more isolation. So, to enhance your BDNF and to increase that synaptic plasticity and the stimulate your prefrontal cortex, you need to engage in social interaction on a regular basis. Make sure, though, it's something that you like. Don't go out and put yourself in a situation that you are uncomfortable with because, you need social engagement to improve your brain. You want to make sure it's something you enjoy. Is it playing a game with your spouse? Is it having some people over for dinner? Is it just going to a concert to listen to some music? So those interactions stimulate your brain in novel ways that is critical for your brain to grow. If you remember neuroplasticity, you don't use it, you lose it. And the lack of social interaction, that constant change that your brain has to react to, is one of the big things that will impact the brain's flexibility. So environmental enrichment, again, this sort of ties to what I was telling you there on social engagement. It needs that stimuli. If you saw those neurons, they are looking to try to connect, right? In that video that we saw early on. And in a lot of ways, your brain, up until you get to age 25, is just doing that. It's out there trying to gather all the information it can, so that it can then decide what to prune and what to go after based on what your interests are. It's very interesting also that some of the research that they're doing with small groups, they're called organelles, in research labs where there's brain tissue in a Petri dish, it is actually creating circuits. The brain is wired and your neurons are wired to go out and explore. And that is part of your natural brain activity. And if you don't go out and put yourself in these situations, then it atrophies. And then the other piece of this is stress reduction and emotional well-being. We talked a little bit about oxidative stress. So if you're stressed, your brain produces um, oxidative stress and free radicals, and that in itself stops neuroplasticity in your brain. So you want to try and calm yourself, and not only through meditation, which is exceptionally beneficial here, but through mindfulness. Mindfulness is paying attention to your reactions, how or engaging with others. So checking in on what you're thinking, that is the mindfulness component of it. And those two, mindfulness and meditation, really work together to calm your nervous system and put it in a state where it's open to learning new things so that those neurons can grow, so that neurogenesis can occur. Pharmaceuticals is really the next area. And so two kind of buckets here, right? So there are those drugs that are regulated by the pharmaceutical industry that create and stimulate activity in your brain. And then there's this other area, really psychedelics, and you can almost put hormone replacement therapy in that bucket as well, of what's sort of on the edge and up and coming. And depending on your approach to those, you may not be willing to try those. They're somewhat controversial. So I did want to kind of draw your attention to that. So within the drug category, there's neurotropic, nootropics, and psychostimulants. And these are things like SSRI, so Prozac, for example. And it is these, again, back to BDNF, right? And creating synaptic plasticity. These things really open up your brain's ability to grow. And the nootropics, these are things like, so the modafinil is for narcolepsy. These are for other types of challenges that are neurologic, but they also, while they're addressing those specific areas, they do increase your focus, they do increase your memory, and put your brain in a plastic state. And there's the psychostimulants that if anyone who has ADHD would be very aware of those. They boost your dopamine, norepinephrine, and other neurotransmitters to really enhance that synaptic transmission. But the negative of that is that they may impair cognition, right? So you can't, you have to be very careful how you use these and pay attention to the side effects that are occurring. Okay, so that's one category. And then the next category is psychedelics. I want to start there with this group because there is some phenomenal research that is occurring with the use of psychedelics to really put your state into almost unforeseen area of plasticity. The only other time you see like this is when you have an injury, a brain injury, or when something has occurred like a stroke. Your brain is in an extreme state of plasticity for a short period of time, which is why it's so important to start therapy right away after you've had an injury within, certainly within 2 weeks, if not within 2 to 3 days, because you will just learn and recover faster. But with psychedelics, a lot of the research that's being done out there right now is with trauma patients. So people, PTSD with veterans, individuals who have had some sort of, social trauma, and they're showing remarkable results. And you need to be sure you do that with integration. Those have to be combined with psychotherapy. Again, just because your brain is in a state of plasticity, you want to make sure you're guiding it in the right direction for the changes that you want to make. And that's the case with all of these, right? So if you're on these pharmaceutical medications, know that your brain is in an excited state of plasticity, and what you do to change it is going to have faster results. And then this last piece for hormone replacement therapy, it's for women in menopause, and you'll read a lot about this when you go into Bredeson's protocol and some of the other multimodal type approaches. Hormones are an extremely important part of your brain's plasticity, and so putting yourself on hormone replacement therapy for women, estrogen and testosterone, and men even on testosterone and estrogen in some cases, depending on where you are, can improve your cognition significantly. And I experienced this personally. I was having some issues with cognition. I went to go see about I went to one of the Bredesen protocol physicians because I thought, oh my goodness, I can't remember. I'm having real trouble remembering where I put things, and so I need to go see about this. And turns out it was my hormones. And within 3 weeks of getting on hormones, I returned to my old self. So it's extremely important to check. And again, your blood work on these things is going to be exceptionally important. Okay, so we've learned a little bit now about the categories of things you can do to enhance plasticity. The other things we want to look at is what do you need to do to make sure you're removing all the things that are prohibiting plasticity in your brain. And these are some examples. This is not the full list, but these are sort of the buckets, if you will. So environmental toxins and pollutions, these are things like plastics in your water, plastics in your food, pollution, air pollution is a significant factor that can contribute to this. If you're lead in the water, for example, your water quality is another thing you really need to take into consideration. And mold, this is the other big one, I think, that's really not very well understood. And it has a tremendous impact on how your brain works. It's worth going to get a study if you suspect you're having some issues to make this part of your discovery process. And then the last one is your food allergies. And I threw substance abuse into this bucket because while they're two very different things, they work very similar in that they decrease your memory and your focus. So you're having an allergic reaction to that. Again, it puts your body in inflammation state, which decreases the ability for your synapses to communicate. Okay, so when a lot of people think about neuroplasticity, this is the part that they think about, right? What activities do I need to do to retrain my brain? But as you've learned, the state of plasticity that your brain in is almost equally as important, because the work that you have to put in when you're remapping your brain can be a lot less, and you can really minimize it, because the older you get, the more effort it takes to retrain your brain. And so you want to make it as easy as possible. And these types of interventions are what will help you change that change those the way your brain functions and rewire it. Okay, so there are a lot of buckets on this slide, or a lot of things, and I'm just going to go through each one very quickly because it's a long list. So constraint-induced therapy, this is where maybe a lot of people who have had stroke or an accident and damaged the nerves is so you're binding one arm to your good arm so that you're forced to use the deficient limb. And you, with practice and with focus and with effort, this is shown to work significantly well. Nowadays, they're combining this with vagus nerve stimulation. It's something that's new to really accelerate that. You can do this exercise with vagus nerve stimulation and accomplish in like 3 or 4 days what it would take you almost 20 days to accomplish without it. Neuro movement. These, I guess, Feldenkrais and Anat Banal are two of the providers in this space that have really been very phenomenal and done a lot of work. And it's small incremental movements that are slow and where you're focusing on it to get your brain to pay attention to that movement. And that really cements the brain's function in there. So task-specific training. This is an area where you are doing a certain task. So I want to be able to dribble the basketball, for example, if we're talking about, enhancing our performance, right? You want to do that over and over and over again in a certain way to be able to improve your function on that. Fine motor and skill-based training. This is where, writing is one of those things. Painting, these are very fine motor movements, and you can enhance this. It works very similar to the task-specific training. And there are a lot of I guess processes online you can look at to leverage here. An occupational therapist certainly would do this. Physical therapy is another one that you could also get this training at. Mirror therapy and visual training. This works similar to constraint-induced training. So you're looking at a mirror and seeing your reflection to help force your brain to work harder to do those processes. Rhythmic and auditory stimulation. So you're combining music, like maybe even a metronome. There's a lot of therapies out there now that's using gait. You'll see this for Parkinson's patients, for multiple sclerosis patients, where you're using music. So that's a one sensory and movement to retrain your brain to walk again. This is now being used a lot with indirect vagus nerve stimulation through under the tongue triangle therapy, and that indirectly stimulates the vagus nerve to accelerate that. So combining those two has proven very effective. Balance and proprioception. Again, your physical therapist is now integrating these and has specific exercises to rewire your brain so that you can regain your balance. Dance and rhythmic movement. So this is a little bit different from rhythmic auditory stimulation because it is much more complicated, and for individuals who maybe have a greater level of function. The way these work is because you're using two different sensory components, right? You're moving your body, so that's movement. You're using your ears and to follow that sound, and because you're using multiple sensory actions, it's going to accelerate how quickly that works. On the next section of this slide, I'm going to skip to sort of, well, bilateral training is basically, skip it. The bilateral training is just combine different together functions. So you're walking while you're trying to memorize a poem. You are listening to music while you're trying to move. You are dancing while you're trying to recite a speech. So different. Robots and virtual realities, this is an area that's really blowing up. And if you combine virtual reality, um, and the use of robotics to help assist your movement and to help your focus, to learn new processes, this does work. It doesn't work as well, quite frankly, as real life activity, especially when you're engaging with another person. So, but it is helpful. It is helpful and shown to make a difference. Neuro-optical. This is as I talked earlier about Dr. Zelinsky, so it's the way your eyes work and the sensory information coming to that to integrate with your touch, to integrate with your hearing and your other senses. And there are individuals out there like Dr. Zelinsky that help integrate those. Listening therapy is, again, this is the one that my daughter went to. It retrains how your brain hears, which affects your spatial reasoning, your ability to process information. This really could help you with anxiety, ADHD, and it's had a huge impact on people within the autism spectrum as well. Um, and I'm going to skip down to, I think we've kind of covered these others. Breath work, I think, is very self-explanatory. And then emotional and amygdala retraining. There are people out there and processes. This is to help you control and retrain your emotions, right? So the amygdala controls your emotions, and if you've got emotional dysregulation, there are processes out there that will help you to learn how to recognize them, and how to modulate them. So in the cognitive enhancement area, so this is where you're trying to retrain your brain for memory and attention. And there are a lot of digital programs out there now that you'll see. So Luminosity, Brain HQ are two of those that I will say I do think they help. They've been shown, there's research to show that they help. But again, it's not as effective as that personal interaction. Doing a puzzle with one another is like one of the best things that you possibly can do within a group of people, because you're not just using your vision, right? You're using your sense of touch, you're using your sense of hearing. Again, it's that multimodal approach. Learning new skills. So this is an extremely valuable way to train your brain to learn new things. And it not only puts you in a greater state of plasticity that we talked about, but because you're in that state, it opens up the pathways that allow you to learn much quicker, right? So if you want to learn a new skill and you want to say learn to play an instrument, that ability to use multimodal function, again, you're using your hands, you're using sound, it will enhance your ability to increase your memory significantly. And the last group I want to talk a little bit here is neuromodulation. So what is neuromodulation? It is external ways to change the brain typically through devices, right? So there can be invasive and non-invasive ways to do this. You've heard me talk a little bit about the vagus nerve stimulation. That is an invasive process primarily. They put a small electrode implanted into your vagus nerve, but there are also external vagus nerve stimulators that you can just apply. It's a little small device on your vagus nerve to help with that. Those they are beneficial, but they're not necessarily they're certainly not as beneficial as the implanted device. So transcranial magnetic stimulation. So this is changing the magnetic stimulation of your brain through a device that enhances that plasticity. Again, you have to pair that with some behavioral modification if you're trying to change something. And you find these at a lot of brain care places have these devices now. They're pretty well known. And you have to have repeated treatments with this, but they have shown to work not only for depression, but for memory and for anxiety as well. Transcranial direct stimulation. So this is putting electrodes on your scalp to really stimulate the brain with electricity. This increases blood flow, as does the magnetic stimulation, which enhances those synaptic functions. Photobiomodulation, you've seen a lot of this red light therapy probably out there. This works by enhancing the blood flow as well. Um, the virtual reality and combination with transcranial magnetic stimulation has also been shown to be very effective. Robotic and exoskeletons, this is another area. And then the trigeminal nerve stimulation, this is what I was speaking about earlier, where you put a device typically under your tongue, and that indirectly affects the nervous system. You see there are quite a few PONS devices is one of them, but there are other providers out there that is showing significant benefit for people with multiple sclerosis and Parkinson's to support their gait and their movement processes. And the invasives, you've heard of deep or brain-computer interfaces. This is what Neuralink is doing. They're implanting electrodes into the brain that interact with the nervous system directly. So not only do these work by stimulating the nervous system at its at its direct area, depending on what you want to influence. It also then interacts with the brain, and those two begin to work together and stimulate brain plasticity, and it changes the way your brain actually works. Um, Deep brain stimulation is implanting an electrode actually in your brain. Again, shown to have very significant benefits for depression. We've talked about vagus nerve stimulation, and the cortical stimulation is works very similar to sort of the brain computer interfaces. And the last piece here is this neural tissue transplant. So this is an emerging area that is happening now where they're taking new neurons and implanting it into the brain to see if it works. This has not been done in humans. It's been done in mice, but it's showing significant benefit, especially for people who have had a stroke or a brain injury where that tissue has just been demolished. And I wanted to bring that up because it is something I think you'll see here in the next I would say maybe 5 to 7 years. Okay. So that was a very quick review. I hope that was helpful as an overview. And I want to turn now to one last case study, and we're going to bring on Dr. Golden, who's going to share a neuroplasticity-based therapy that she's developed for persistent pain with you. This story starts with Dr. Mark Moskowitz, who was he was a psychologist and turned pain manager. He had a clinic in California that treated people with severe pain. It's where people who go to really, unfortunately, die with their pain would go. Dr. Moskowitz had an injury himself, water skiing, and he had neck pain that progressively got worse over 10 years. It moved from one side of his neck to the other, down his back and over across his back and through down his hip area, and he became very debilitated. He knew about pain, he learned about neuroplasticity, and so he devised a visualization technique that enabled him within 3 weeks, or I'm sorry, 6 weeks, to really go back to the original pain that he had after when he first had his injury before it had migrated across his body. And within 4 weeks of using this visualization technique, 4 months, he really kind of shut down the pain. And after continuing to do this for 1 year, it was completely eliminated. It required very focused effort, a lot of repetition, and for it to work. But because he saw some initial progress, he started treating his patients with this who also saw recovery. And then he began to use that on a widespread basis. Um, then along comes Dr. Golden, Marla Golden, who also had her own challenges with pain. When she was a young child, had a viral encephalitis that led to debilitating migraines and then cognitive challenges because of the pain. Her mother, before anybody even really knew about neuroplasticity, started she just developed some of these protocols herself to help her learn how to modulate the pain, how to get past it, and then how to relearn and catch up with her peers so that she was able to return to school. Um, Dr. Golden then really brought an osteopathic framework to what Dr. Moskowitz was doing, and she was using sort of several techniques that were out there in fascial manipulation. That was sort of the basis for what she was doing, but then used that to develop her own method. Then she and Dr. Moskowitz got together. They developed really researched and developed a completely new protocol that is available, and she's going to walk you through what that protocol looks like from a high level and teach you a little bit of how to utilize that. So I want to just, yeah, let's see.
Can you see me? I think I opened up my camera and
Yes, I
hoping you can
hear
hear
you.
me.
And let me move. Okay, so I need to share the screen with you.
And I could put some images and things up, but thank you, Sherry. Thank you for those nice introductions. I will make two minor, well, I don't know, Michael would probably think they were major corrections, to give him credit where
Okay,
credit is due. He's Michael Moskowitz with a K. He is from Sausalito. He was a psychiatrist and pain doctor, so he's an MD, not a psychologist, a
okay.
PsyD or a PhD. And you very well described some of what led him to looking at pain very differently. And for him, it was a very acute and personal incident that had happened closer to the time that he and I met, with respect to, my issues and injuries and problems, which I experienced as a younger child. So here we were, both pain physicians working in our respective practices, since he came from psychiatry and was in pain medicine, and I was an osteopathic physician, trained originally in emergency medicine, but had segued into a very integrative practice that was steeped in manual therapy, osteopathic manipulative techniques, craniosacral, and was kind of studying all different paradigms in terms of Chinese medicine, Ayurvedic medicine, how different schools of medicine, if you will, or schools of thought, kind of thought about the body with respect to pain and problems, and how they got in and what methodology they utilized. And it was really fascinating. But I was using treatment plans, or incorporating manual therapy heavily into my treatment plan after a very focused musculoskeletal exam, to make sure that patients didn't have places where I could optimize their structure and take away some of those problems right off the bat that other people may not have noticed. And then, incorporating all the other basic tenets of a pain care treatment program at the time, except neither one of us chose to do what we called big needles, which were things like the spinal facet joint blocks or epidural steroids, injections under fluoroscopy, insertion of spinal cord stimulators, those sorts of things. We were both writing questions for the American Board of Pain Medicine one weekend when we met and started lamenting the fact that patients weren't really getting better, and that, there had to be something wrong with the current state of pain care. Not the least of which was that patients were kind of getting relegated to medication graveyards. And once their acute interventional techniques were exhausted. So they would undergo a series of injections if it was something that lent itself to injection therapy. And when they couldn't have more steroid, or they just weren't getting any results, or they had gotten as much of a result as they could have, they were often, in the medication management arena. And we all, as pain doctors, did a lot of medication management. And we talked about the polypharmacy of pain, where at the time opioids were a mainstay. We could all go through that debate, but that's a whole other conference. But muscle relaxers, antidepressants, anti-nausea agents, headache or migraine medications, all sorts of medications. And it just seemed like patients were bouncing back and forth from one thing to another. And it did occur to us that in that model, acute interventions, or interventions to ablate acute pain, were being utilized on chronic pain problems. And so we started looking at a lot of articles and researching a lot of things, and a lot of science, basic science and applied science that was out there, to understand what was really going on with this process of persistent pain, which was a constant and unrelenting barrage of signals to the brain to kind of almost embed those pain tracks in, from the periphery to the brain and back out again. And recognizing that, patients were having things done to them, but there was a lot of time in the mix where none of those practitioners were around, right? Patients go home, they live their lives, or they try to. And, those passively applied treatments might work for a time, but how could we move patients more into a place of taking control of their pain, honestly believing, or at least imagining, the possibility that they could have less pain or be out of pain, and helping them to understand what they could do to help their pain. And it was then, that Michael shared his experience with his visual imagery work, and the relief of his pain. Interestingly enough, we were well into the development of the neuroplastic transformation program when I said, this is exactly what my mother did for me and with me when I was 11. So she was really inspired. She believes, and I do too, that it was divine inspiration to, and not being a medical person, to work with me in this way, because what she did and what we developed was a program that utilizes the property of neuroplasticity that we all possess. That is our ability to change in response to whatever we do repetitively, whether it's a thought, whether it's an exercise, whether it's, invoking counter stimulation of the senses, which is what our program is based on. Our brains and our bodies will reliably change in response to whatever we do repetitively. And it's an amazing thought. It's very empowering. It's very validating. And it allowed people to start kind of saying, okay, this is in my head, but not in the way a lot of other doctors are saying it. It is coming from command central. It is being modulated in the brain with that connectivity through the connective tissue system to the body and back again. But we can intervene. And so we move patients more into the place of an active client, if you will, rather than a passive patient. We wanted people to get to the point where they had worked with us to learn neuroplasticity techniques in the form of repetitive counter stimulation of the senses, as long as it was pleasurable and stimulating, something they liked, something that got their attention even more so than their pain, and that they could do, that was easy and portable and usable just about anywhere they were and at any time that their pain was really creating a problem. So what did we do? Well, we created this whole program. And one of the biggest, tenets is that you do have to kind of reroute your thoughts and beliefs about pain. A lot of people would say, I don't believe I can ever be any better than I am now. So we would work a lot with thoughts and beliefs at the outset, help them to understand that that power that they held within themselves was really very real, very scientific, very proven, and it was what they were going to rely on and use to try to alleviate their pain or at least lessen it to a much better place. I could, get into a lot of this program, but it would take us a long time. And so for, excuse me, for each one of the senses and portions of our program, you can think about the passively applied counterpart to the active work that a patient can do. And it's that active work that we're going to talk about. And it's very, the stuff, the work of it is simple. The hardest part is the repetitive or the need for repetition. And sometimes people don't understand that. They'll say, oh, I tried that once. Well, it doesn't really work. It'd be lovely to think we could do it once and it would go away, but don't forget that this pain process is ongoing all the time. And most of the time, patients are coming into this, having had their pain or their problem for some time. Before I go on, I don't want anybody to think that this methodology replaces or alleviates a workup and or other treatments. I mean, in fact, we really recommend a multidisciplinary approach to people's pain, but this is that individualized, personalized plan that's portable and what we call self-directed and self-efficacious. So if we think about the senses, right, we are wired by our senses as babies, our caretakers, our mothers, whoever's caring for us or interacting with us, they might be stroking our skin or holding our little hand. A baby that nurses or is in their mother or father's arms, they smell them, their intrinsic scent of their body, but colognes or perfumes, products, right? They see them, they hear them. So it's very elemental to utilize our senses to try to break up this persistent pain process. Excuse me. If the biggest thing we ask, like I said before, is that it's stimulating and pleasurable. So for me, if we, or for any of us, if we're thinking about the senses, we stayed away from taste, chewing, oral stimulation in the initial portions of our program. It's a modality or a sensory stimulation that I intend to kind of put forth next. But for now, we'll talk about the sense of sight and the visual cortex, the sense circuit or the sense of smell, the auditory circuit or a sense of hearing, and then touch, which also kind of encompasses movement to some degree. You can actually advance from these very basics to incorporating things like relationships and autobiographical memory. And in fact, Sherry, some of the very things that you were talking about that are kind of additive with respect to the neuroplasticity effect. A lot of those treatments that you were talking about. I don't know if I'm going over time, but let's see if, do I have a few more minutes to just give you some examples? Sherry? I don't know if she's on there. Okay, I don't hear anybody. Sight or vision?
Sorry,
Mom.
Mom.
If we,
That's okay.
Yeah, can we try to wrap up in maybe like 3 minutes?
Yep. Visual
Okay.
imagery, you can use that, or you can imagine, you can have somebody walk you through it, or you can imagine your pain. You can create your own visual imagery. You can look at pretty pictures repetitively, pictures of people you love or enjoy. Sound circuit, you can listen to your favorite music. You can use vibrational sounds like Tibetan bowls and tuning forks or white noise, nature's types of noises. Touch, we always told people, create a little grab bag of things. I put together swatches of satin, silk, velvet, tweed, and a plush fabric and put them on a little ring. And I would keep them in a little bag with a nubby shell and a smooth stone. So very portable things that you can do. Light touch anywhere on your body. It doesn't have to be the painful part, is soothing, stimulating, and it's one of the fastest signals into your brain. The more you are doing something, the better it's going to be, but you have to give yourself periods of rest. Scent circuit, I don't know if you can see me. We used 100% peppermint oil because peppermint has been shown to block the release of substance P, a chemical in the brain that lets you understand that something is painful. It is only 2 nerve connections from your base of your nose to your amygdala, which is the first place in your brain where you process pain and you also process fear, anxiety, nausea. So repetitively, determining which senses you want to use and just starting to utilize things in those categories repetitively throughout the day or when your pain is problematic, is the basic approach to our methodology. It's very simple. The neuroscience is complex and rivetingly interesting, but you don't have to understand all of that to be able to use the techniques and start to interrupt those pain circuits and disrupt your pain sensations. So I'll leave you with that.
Yeah, thank you, Dr. Golden. So just in essence, right, to kind of summarize that, you're displacing the pain with pleasure sensories and retraining your brain to focus on those pleasure components, which wire apart, right? And you're not, so you're killing
It's not just a
circuits.
focus, it really is interrupting. So if we're wiring to the pleasant, stimulating sensory input that we're putting in, then we're literally breaking up that wiring and those pathways for the persistent pain. Your brain can't do it all at once. So if you can, kind of counteract those pain signals by putting in other signals that are stimulating, you'll break up that pain circuitry. What gets fired gets wired, I think is where you were going, Sherry.
Yeah, and what fires apart stays apart, right? So you can break it on both sides of it, right? That's the
You
thing.
can wire
Well,
away
Dr.
from
Boland,
it.
thank you
Yep.
so much. I hope that everybody found
Welcome.
some value in that, and we certainly
Me too.
appreciate you joining us tonight. I want to encourage everybody to join us next week, where we'll be talking about how to take these treatment categories that we have discussed and look at how to apply those for your own special circumstances. And let's see.
I'm typing something to the participants. If there's some aspect of the program that is of interest, I think at some point I'll be back, Sherry. If they let you know, I'm happy to focus on one aspect or another. Tried to give just a broad overview.
Yeah, great. We will be having Dr. Golden join with for until January for this special series, so we can have questions and they can reach out to you independently. You can connect with NPA for additional contact information if it's needed for Dr. Golden. Okay. Well, let's see here. I am having a little bit of trouble advancing us to the next slide. So.
I think I'll say good night. Thank you
Yeah.
so
Good night,
much.
Dr. Golden. Thank you
Bye.
so much.
Yes, bye.
Do you have any advice here, Nancy? Yeah, I'm not sure what's happening on our end. We're having some challenges. But so I'll just sign off. I think that kind of brings our discussion tonight to a close. Please do, if you want more information, please visit us on npallies.org. We'd love to have you volunteer and join us. I'm happy to take some one-on-one discussions with anyone who would like more information about your specific situation if you think I can help guide you. And then also I want to encourage you to please, if you found this valuable, please hit that donate button on our website. We'd appreciate any support so we can continue to share the information that we have with everyone. All right. Good night, everyone. Thank you so much. We'll see you next week.